Welcome back, everyone, to Let's Talk About Sleep. Today, I am not going to show you the book, as I always do, although there is a picture of it back there. There is a link. The Amazon link is in the description box down below, but I figured I'd save you guys the showing it again. And as I always say, these videos are for educational purposes only. Okay, so with that out of the way, let's talk about today's topic, which is another alternative treatment for sleep apnea. Last week I mentioned the other alternative things that we use, the pillar implants, for example. Okay, you can watch that video. It was last week. But I said that there is an implantable nerve stimulator that I was going to make a whole separate video on, which is this. Okay, so just to kind of step back, as I always do when we talk about sleep apnea, it's the tongue kind of falling backwards, closing off the airway, right? So the goal is to keep the air space back here open, okay? CPAP, as you remember, the way it works, if pressurized air comes in, goes all the way down to the back of the throat, forces the airway open, okay? So what a nerve stimulator is, and the one that we use here at Cornell, there's different ones, but the one we use here is called the Inspire device. Like I'm inspired to make this video, right? Or inspire, the way I breathe in, okay? And what it is, it's a little device that gets implanted into the chest wall, okay? It's kind of like a pacemaker if you look at it. And this device especially, again, there's different kinds, but this device, the way it does is it gets implanted into the chest wall, and there's one wire which kind of analyzes what's called the intercostal muscles. So in between each rib, there's intercostal muscles, and as we breathe, or one of the ways we breathe is the intercostal muscles contract. So you can actually see the activation occurring. All right. So what this device does is it has a wire which looks at the intercostal muscles, okay, and it can sense when the person's about to take a breath. And then there's a second wire which goes underneath the skin all the way up to the hypoglossal nerve, hypoglossal. This is the nerve which controls the tongue muscle, okay, the genio muscle. It's cranial nerve 12 for neurology nerds out there like myself. So what happens is basically this device, once it's implanted, okay, and it's an outpatient procedure, once it's implanted and these two wires are in place and it's healed and calibrated, the patient will turn it on with a remote at bedtime. And essentially what it's going to do is it's going to sense when the person's about to take a breath, and it'll send an electrical impulse to the hypoglossal nerve, to the tongue muscle. And what that does, it basically stiffens up the tongue with every breath. Okay, so the person's tongue is not able to fall backwards and close off the airway, i.e. sleep apnea. Okay, it sounds very bizarre. It's very Twilight Zone-ish, but it works. Okay, this procedure has been around for about 5 or 6 years now. Okay, Cornell actually was one of the first places to do it, and my colleague who does it, her name is Dr. Maria Surna, Suurna. She's great. But it's a procedure, right? It's a surgical procedure. It's implanting something into the body, and a lot of patients don't like the idea of that. Now, the commercials that are out there, they don't really tell you what it is. They just say, "Oh, I don't have to use a CPAP anymore. Isn't this great?" But that is what it is. Okay. The way I view it is I kind of reserve it for more severe cases where somebody can't use CPAP, or they've tried CPAP, they hate it, they can't tolerate it, or there's not really any other thing we can do for them. This is an option, okay? So it does work, but there are any kind of time you do any procedure like a surgical procedure, there's always risk of infection, there's risk of it not working, so on and so forth, okay? But it is good, and I think in time it will become more popular, but it's still kind of in that kind of peripheral thought process for doctors and for patients, but it is out there, okay? Yeah, so that's the nerve stimulator for sleep apnea, the new kid on the block. Definitely interesting, definitely works, but it's got to be for the right person, okay? And one other thing that they don't tell you in the commercials is to make sure somebody's an appropriate candidate for this, they have to do what's called DISE, which is drug-induced sleep endoscopy. So the ear, nose, and throat doctor who's going to implant this into the patient we'll have a patient basically undergo anesthesia. It's almost like what you would have during a colonoscopy. And they'll take a look at your airway. Okay, they got to make sure that the airway closes what's called anterior posteriorly. So basically from front to back, it kind of closes off that way. If it's concentric, which means it kind of closes in a circle, the person's not a candidate. But if it closes front to back, A to P, anterior posteriorly, they're a candidate. Okay, and there's other requirements as well, but if you're interested, certainly talk to your provider about it. Like I said, most sleep docs will not do this procedure, but we will refer to an ear, nose, and throat surgeon who will. Okay? So that's today's video. If you like it, please click like. Please subscribe to my channel. As we're inching towards 1,000 subscribers, a lucky viewer will get a signed copy of my book, which I did not show today. Okay? So please ask questions, leave comments. Once a month, I will do a video answering all questions and comments. And until next time, sleep well.